Everyone, welcome. I'm Stephanie Haynes. I use she, her pronouns, and I am the director of Philadelphia Family Pride. And we are here today to talk with Dr. Alexis Lieberman. She is a pediatrician here in Philadelphia at the Fairmount Pediatrics, Advocare Fairmount Pediatrics practice. And we're going to ask some questions, have a conversation about COVID, kids, and back to school. So thanks for joining us. And should I call you Dr. Lieberman or Alexis?
Stephanie, we've known each other a long
All
time.
right, Alexis.
Call me Alexis.
Okay, great. That's true. We have known each other a while. And I should mention Alexis is also a PFP parent. And although her kid's older, used to be more involved in the group, as many of us learn as our kids get older. Anyway, so I guess we can start with, is there anything else you want to say about you or your practice, or sort of what kind of brings you to this topic?
Well, hi, Stephanie. It's nice to see you.
Hi.
And I'm happy to be doing this for Philadelphia Family Pride. I'm a pediatrician in a general pediatrics practice. So I'm not a researcher. I'm not part of the CDC, but I'm definitely fielding questions every day about going to school, going back to school, about the Delta variant, and a million small questions about, should I go to a wedding with my child? Should my child do a dance class? Those kinds of things are coming up for people every day right now. And they're difficult questions to answer. So I'm happy to have a conversation with you about these things, and hopefully it'll cover some of the questions that that the members have.
Great.
Yeah.
Yeah, I think one of the things people are definitely interested in is how to make these decisions, right? So there's so many little decisions all the time that people are having to confront. And I think giving people information to help them make those decisions is really the goal of this conversation. So let's start. You mentioned the Delta variant. Let's start there. So I know one question parents are grappling with is, how dangerous is the Delta variant for unvaccinated kids? And I would say, I think I would take this question as to be kids under 12 who aren't eligible to get the vaccine. Right.
So the Delta variant is much more contagious than the previous version of COVID that we've been dealing with for a year and a half. It might be more virulent and it might not be. There's not enough evidence yet to state that. Some of my reading is saying that people are getting sicker with it, but most of my reading is saying that it is simply more contagious. Some people are saying it's as contagious as the chickenpox virus. So pretty easy to catch it. So for your unvaccinated people, they're definitely at increased risk of catching it. And I'm seeing COVID much more among older kids who aren't vaccinated, where the parents have chosen not to vaccinate. And I'm seeing COVID in younger kids. And for the first time this summer, I'm seeing kids catching COVID from other kids. Whereas last year, all of my patients who had COVID got it from their parents, all of them. And now for the first time, I've had kids get it from another kid at school. So it's gotten a little bit easier for children to get it.
And that would go with what you were saying about the Delta variant being more contagious.
It's more contagious, and that's why I think we're seeing more of it. And seeing more of it among kids. And before, we felt like, especially young children, they didn't create enough air force to spread that virus. And now, because it's that much more contagious, they're able to.
Right.
I think is what's going on.
And maybe just one question on the contagiousness, that's probably not the right word. Is it that people who have it produce more virus? Is that, or it's
No.
The virus itself is easier once any of it gets near you, it's easier it latches on better or something?
When you think about contagiousness of a virus, the question is, how many virus particles, how many virions do you need to get into your respiratory tract to get sick from it? And so the more contagious it is, the less virus you need. So for a not very contagious virus, you might, talk to somebody for 10 minutes and it wouldn't be enough to catch it. But if you sat down with them for an hour, it would be enough.
Right.
For a very contagious virus, it might be enough just to talk to somebody for 5 minutes.
Right.
Now, I don't know where the Delta variant is in that how many minute scale. I'm going to keep sticking with what the CDC says, which is that a contact is 15 minutes face to face without a mask, less than 6 feet apart.
Got it.
So I'm still not scared when I walk
indoors or outdoors or either one.
outdoors. You're going to have more ventilation and you're going to need much more contact to get whatever amount of virus you need to get sick. But you could catch it if you sat face to face with somebody outdoors for an hour and they had the virus. Sure, you could catch it. You're less likely to get it outdoors. And that's why my main advice for all the different questions people are asking me is, if you can do that outdoors, do it outdoors.
Yeah.
I'm not hearing about people, and my patients are not getting COVID outdoors. My patients who are getting COVID are getting it indoors with people who are not wearing masks.
Got it. Okay, that's good. That's all good things to hear. And
even then, it's not a guarantee. I have one patient who sat at a brunch table having brunch, and then the next day found out that one of the people at their brunch table had COVID at the time that they were sitting there. Well, the 3-year-old who was sitting at the table still didn't get it. Yeah. And you can picture a 3-year-old at a brunch table. How long are they really at the table? And are they really face to face with the other people, or they're face down to their plate and then they're gone? So that 3-year-old didn't get it even though they were there. We tested. Yeah. I want to comment about the testing because people are coming in too soon for their tests.
Okay.
Wait 5 days from your contact. If you were a known contact of COVID, wait 5 days for a more accurate test.
Right. If you come too soon, you may not have enough virus to get a positive test.
Exactly. And then you're falsely reassured. Stay home. Don't be around people if you had a real contact, less than 6 feet, without a mask, 15 minutes or more. And then you find out that that person had COVID. Just stay home and don't be around people. Wait the 5 days and then get a test.
Right. So the next questions are questions people sent in that are a little bit more specific to their situations, but I think other people can kind of learn from them. This one actually has to do with school and learning, online learning versus school. So the parent writes, I'm worried about a last minute switch back to online learning, which was very hard on both of my children, their ability to learn and their mental health last year. How can I best help our family deal with uncertainty and support my kids in the case we end up back online and the kids are 4th and 2nd grade this year?
The kids who seemed to do the best with the at-home stuff last year were the ones where they were able to be in a pod. And so it might be worth having a backup pod. Some kind of group of kids where either, you and your friend or neighbor down the block who has a kid a similar age, either they're both going to school together or they're both home together learning online. I think that that's going to protect their mental health and maybe even be able to be presented as just how things are going to be. Sometimes we're at school learning with our friends, sometimes we're home learning with our friend. That's what school is like for you these days. Now that's facile to say though, because not everybody's able to do that and people have trouble. I think the hardest thing is for the parents having childcare for their young children. Right. And so again, having people to share with, finding other people so that, my work can be more flexible on Mondays and Tuesdays, your work can be more flexible on Wednesdays and Thursdays, or my work is never flexible, but I can do the driving to school when they're going. Some kind of sharing and supporting each other as parents is absolutely necessary. And then kids are flexible when their parents are flexible. So just practice saying, oh, well, a lot. Model it.
That didn't go how we thought, so let's figure something else out, right?
Exactly. When kids see their parents being flexible and relaxed about stuff, they're fine. The kids copy us.
And we'll do other workshops to help parents be relaxed. So
Okay, yeah, because I was
we'll
say,
work on that separately.
that's easier said than done too. But do your daily meditation, writing your journal, take care of yourself so you have something for your kids.
Absolutely.
Yeah.
All right. So this one is a question about daycare. So my kiddo is at a daycare that doesn't require or enforce masks for kids, even at age 4 and 5. My daughter won't keep hers on without encouragement. I wish they did require masks for kids. Should we push the issue? What can we do as parents to urge the school to do this?
All right. Well, parents of daycare kids have a little more power than parents of school children, because you're paying for it. But for sure, you guys are the customers. So absolutely. I think we were all so sure that those kids couldn't wear masks. And it turns out they're great at it. They don't care. They're totally good at it. As long as they see their parents doing it, they are great at it. And there's a million fun masks and the kids like to show them off. And I don't think it's a big deal to make kids wear masks at all. And absolutely, they should wear them when they're at school. And the teacher should be wearing a mask at school, and good ventilation at school. Those are the things that are going to protect the kids, and tons of time outdoors, good weather or bad. They should be getting those kids outdoors. So yeah, I think the parents in the class need to get together and go to the director and say, we want the kids to wear masks. We want the teacher to enforce it. And furthermore, I'll go out on a line and I'll say, I think it is reasonable for parents to say to the director of the daycare, we would at least like the school to encourage parents to be vaccinated themselves, and maybe even go so far as to say, for kids with unvaccinated parents, we would prefer if they were cohorted. So that in their own class. And the reason, that sounds terrible, but I have to say, the kids who I see getting COVID are getting it somehow through an unvaccinated channel for the most part. So, the kid got COVID from the other kid in his class whose uncle wasn't vaccinated, but spent the long weekend with them. Right. It's all stories where you can locate an unvaccinated person at the beginning of the string of cases. Yeah. So what puts your kid at risk at school is actually the unvaccinated people that your kid's classmate is spending time with. Oh, that's terrible, because you don't want to ostracize a child because their parent decided that they didn't feel comfortable with the vaccine. And you don't want to put parents in a difficult situation where, because they're uncomfortable with the vaccine, they have trouble accessing childcare.
Maybe
you
just suggesting
it to do anything like this. This is all really negative. But that unvaccinated parent or that unvaccinated uncle who came for the long weekend, they are your child's risk. In this case, they really are.
So it sounds like for daycares, my suggestion to this parent would be, if you can take, at least you can threaten to take your kid somewhere else, or a group of the parents could threaten to take their kids somewhere else if if the childcare center doesn't get it together to enforce mask wearing.
Yeah, mask wearing is a bare minimum for 2 and older. There's no harm to it. It doesn't make people have too much carbon dioxide. It doesn't hurt their brain development. There's just no harm to it. And it's just a win-win-win. It absolutely is helpful. It absolutely reduces getting COVID. Now, what about the wedding that somebody asked me about last week? My response to the wedding, and they had the 1-year-old and the 3-year-old, who were supposed to go to the wedding. My thought was, the 1-year-old can't wear a mask at that wedding. Keep them outside. So the ceremony's outside, the reception's indoors. that 1-year-old doesn't need to go into the reception. Maybe there's a babysitter who can come and take the child away. So, or maybe a grandparent who can come and take the child away. The 1-year-old can be at the reception and look super cute and then leave. The 3-year-old, if you want to bring them into the reception, put a mask on them. And then for me, I love to eat. So this was a big old revelation for me of COVID. You can have a social occasion that does not involve eating. Who knew? I thought you had to eat at a social occasion, but it turns out
family visits too. It's like, wow, we're seeing the grandparents and we're not having a meal and it's fine.
Yeah, we can talk, we can be close to people, we can be there for our friends and relatives, important events, but we don't have to eat. And this wedding was going to have 100 people at the reception. And my response was, keep your mask on, eat before you go. Don't eat in an indoor event with 100 people.
No.
That's too risky. There's no reason to do that.
Yeah.
You have no idea who you're eating with, and you're indoors and you're going to catch something. There's no question. Every big super spreader event has been an indoor event that involves eating and drinking, and you can just be there and dance and not eat.
Right. So this is actually sort of similar large population question from another parent. If you were a vaccinated parent but have to go back to work in either a large population work setting or have public transit commutes, what is the degree of risk you may pose to your family, including unvaccinated younger people and or at-risk older folks? So, and then an addendum, regardless of what your employer public transit is or is not mandating, what are some sensible precautions that you can continue to take? I think you sort of covered this kind of already, but is there anything else you would add to that?
The best masks are either the N95, the KN95, or that blue surgical mask with the close fitting cloth one over it. They all have pretty equal protection. And I at work wear an N95. I put it on as I entered the building, and I take it off in a large room by myself to eat my lunch. And I put it back on, and then I take it off when I get in my car. So I wear it all day long, and I'm pretty used to it at this point, and it doesn't bother me. So if I was going to work in a setting where I was going to be around a lot of people, I'd be wearing my N95 or one of those other good masks.
Yeah.
And I would keep it on all the time, and I wouldn't eat with people, and I wouldn't pull it down to talk to people.
Right.
I would just keep it on.
Right.
Yeah, and talk louder if they can't hear me through it.
Exactly. And sometimes I even say like,
do.
I'm smiling, like I have those masks on, I'll just say, I'm smiling, you know.
Yeah. And for public transit as well. I don't think there's anything wrong. We're not seeing COVID spread through fomites. It doesn't matter if you touch the bar on the subway, clean your hands, sure, like you normally would, but that's not how you're getting COVID. You're getting COVID when somebody breathes on you.
Right.
Yeah.
Exactly. So I think this is, again, I'm going to ask the question since somebody asked it, but I think we've mostly covered it. If your family and kids will be interacting with a variety of individuals and groups where there aren't uniform safety standards, so like a competing sports team, after school play groups, varied therapeutic services, foster care personnel, what are some precautions you can take as a whole family to mitigate risk but still keep these interactions?
Well, the outdoor ones are better than the indoor ones.
Yeah.
Fewer people are better than larger people. Larger numbers of people,
yeah.
Larger groups of people. No, I didn't mean the size of the people, I meant the size of the group. Fewer people are better than larger numbers of people. And where there are leaders, ask the leaders to mandate or at least strongly encourage masking. So it's not so easy for you to go up to the other little league parent and say, can you put on a mask? But it's easy enough for the coach to.
Right.
Even things that are normally indoors, like speech therapy, could be outdoors, but that's one person, not a lot of people.
Yeah. And it sounds like from what you said earlier is trying to limit your interaction with anyone who's unvaccinated, adults or over 12-year-olds who are unvaccinated.
Yes, that. And then other stuff you can do just to be healthy. Getting enough sleep makes your immune system stronger. Alcohol weakens your immune system. So a drinking event, you're more likely to get sick than a non-drinking event. So sleep and avoiding alcohol are two things that we know for sure. And happiness, joy, relaxation, those things make your immune system better. So doing things that you like to do and kind of mastering your emotional responses, doing things to take care of yourself, your immune system is stronger. So that matters.
Absolutely. Yeah. Like
Yeah.
I know for our family is like being in the woods, like just going outside and being in the woods. It's like all the stress levels just kind of fall
Yeah,
away.
and guess what? Your immune system strength increases when you're out there. There have been a few studies looking at mouthwash for reducing the spread of COVID. I'm not 100% sure if you gargle with the Listerine, you're less likely to catch it. I think you're less likely to spread it. But that's a super easy thing to do. I mean,
Probably should be doing that anyway, maybe.
I don't know that you're supposed to. I'm not a dentist. I'm not going to comment. But the Listerine gargle has been shown in 2 or 3 studies to reduce the spread of COVID, which is
that might be within a household. Like if one person had it, that might be a good
sure
mitigation. All right, so let's turn to vaccines for kids. So this is kind of the last topic that I think we'll cover. We've had the kids 12 and up. My kids have been vaccinated. I'm sure lots of families in our group have older kids who have. What's the schedule for vaccines for the under 12? And I guess also, is it going to be is it going to be 2 and up or 5 to 11, or what's the kind of next groupings?
What I just read is that in July, the FDA asked for the study population for the 5 to 11-year-olds to be doubled in size and for safety data to be increased from 4 months that they had originally requested to 6 months. So that's the holdup, is they enlarged the study and they lengthened it 100% for safety data.
Not because there was any concerns that they had, just that they wanted to make sure it's safe for kids before giving it to kids. Is that what I'm hearing?
Well, it's been discovered that there are rare cases of myocarditis, which is heart inflammation in young boys after the COVID vaccine. It's very rare. You can also get myocarditis from COVID.
And it's treatable.
Generally, it's self-limited.
Yeah,
it goes away by itself, and the vast majority have gone away by itself very quickly.
Yeah.
I will say I had a case in my practice 2 or 3 weeks ago, of a 16-year-old boy where the whole family had been vaccinated for COVID except for him. They had decided not to give him the COVID vaccine because they were afraid of the myocarditis. And lo and behold, he was the one person in the household who developed COVID. I will say in his case, he got better very quickly. And so he did very well and they didn't suffer from that decision. But I thought it really brought out that overreacting to, it's such a difficult thing, but we have to weigh our risks and benefits.
Yeah.
And so I will say that the CDC has said very firmly that the risk of the myocarditis is far outweighed by the risk of the COVID itself, which also carries with it some risk of myocarditis. So I'm not saying that people shouldn't get the vaccine at all, but the reason that they added that request for more kids in the study and more safety data was because they had found something, which was that myocarditis in the boys, in the adolescent boys.
Right.
So that was specifically what triggered it, the request for more time and more data. So I'm glad that they're asking for more safety data, because when we give the vaccine, I want to be very confident that I can say to my patients, this is safe for you. And if the FDA didn't feel that they had enough safety data, then I wouldn't be able to say that.
Right.
So that is
the 5 to 11. That's the 5 to 11-year-olds you're saying. So then that will be the next group, will be the 5 to 11-year-olds.
The 5 to 11-year-olds are already in studies. There are already 10,000 kids in studies between the Pfizer and the Moderna studies.
Yeah.
So those studies should be complete soon. They should be complete in September, I think. Yeah, it's not September yet. They should be complete next month.
Soon,
And
yes.
in which case, presumably, all of that data will have been analyzed and, made available to the FDA, hopefully by October or November. And that's probably why they're saying that we should have the vaccine for the 5 to 11-year-olds by December. They're saying midwinter. The younger kids, those studies have barely begun. So it'll be longer for kids under 5.
And is that like birth to 5 or like 6 months to 5, or what's the next sort of?
The immune system changes it too. And now I'm just speaking out of what I already know, not what I have researched. When we give vaccines in general to babies, certain vaccines can't be given until 2 years old because the immune system won't respond to it.
They don't work, right?
Yeah, early vaccines are not generally unsafe. Early vaccines are generally ineffective. They don't make you make a response if you're too young to do it.
Yeah.
So it's not that it's unsafe to give a vaccine to a baby, it's that they're unlikely to become immune from it. And the whole point of giving it was to create that immunity. So based on my knowledge of general pediatric vaccines, I would guess that the next age group would be 2 to 5. And then I think infants, it would require maybe different technology or different forms of studying in order to know whether or not they'd be able to mount a response.
Right. Okay. Is there anything else that you're hearing that I didn't ask you about that you'd want to let us know about? Anything else about school? We didn't talk a lot about sort of school decisions.
My thought about school is, if you've always wanted to homeschool, a pandemic is a great time to try it out. If it's something that's feasible for you and that you would enjoy it, it certainly gives you a lot more control over your kids' environment. I don't think that people who don't want to homeschool should. That feels like a mistake to me. The kids where the parents are debating quitting their job or trying to work and educate their children at the same time, and that the children who are holed up in a room with a computer all day by themselves, I don't think that's good for kids. I would rather see you take a little bit of risk that they might get COVID, but at the same time, take care of their educational needs and their mental health needs by letting them be around other people. And here in Philadelphia, we have a pretty high COVID vaccine rate, unlike in other states. And most children who do get COVID do not get very sick. Most humans who get COVID do not get very sick. So while we obviously don't want to get it and we want to do what we can, wear our masks, try to have the adults around the children be vaccinated, I think most kids should go to school. I wouldn't be pulling kids out of school at this moment.
Gotcha. Great. All right. Anything else do you want to add, or maybe a good place to end if you're?
No, I think that that's plenty. I think that parents are doing an amazing job and being incredibly flexible and incredibly resilient and thoughtful. And I'm just endlessly impressed.
Great. Me too. All right. Well, thank you so much for doing this. Really appreciate your time.
Okay. Thank you, Stephanie, for inviting me.
All right. Bye-bye.